guys. I'm going to talk a little bit about supraspinatus injuries, which is actually a very common shoulder injury that most lifters get, badminton players, tennis players, throwing athletes, any people who are doing overhead work. As you can see, I have a model of a shoulder joint up here, and you can see this bone is called the humerus. This is the scapula, and this is the glenoid. So in this particular shoulder joint, as you can see, the glenoid actually articulates with the glenoid actually articulates with the humerus, called the glenohumeral joint. Then up here we have the acromioclavicular joint in the clavicle, which is this bone here, the collarbone, and the acromion. Okay, as you can see, it's actually an extension of the spine of the scapula. So you have the acromioclavicular joint up here. Alright, then you have this articulation of this particular bone to the scapula, along with the thoracic cage. So you get the scapulothoracic articulation, and last but not least is actually this particular end of the clavicle articulates with the sternum. Hence you have the sternoclavicular joint. So the supraspinatus is actually a muscle that originates from the back, as you can see in this model. Okay, the supraspinatus up here. Why it's called the supraspinatus is because it's above the spine of the scapula, so hence it's the supraspinatus. So as you can see here, the supraspinatus, which is this muscle, you can see me moving it, alright, is a muscle that actually goes and attaches to the greater tuberosity of the humerus. And because of that, because of its travel, you realize most of the tendon of the muscles actually below this bone called the acromion. So whenever there's movement at the humerus, okay, there is a possibility to cause impingement of this particular muscle, mostly the tendinous portion, and to a certain extent some of the musculotendinous junction as well. And there is actually a bursa which is actually in this particular area, which is called this subacromial bursa. Basically what it means is below the acromion process there's actually a bursa, a sac of fluid, which allows the articulation or the movement of this particular muscle smooth under this particular bone. So when this particular bursa, this sac of fluid that is underneath here, gets inflamed, what happens is this really small space becomes very, very tight. So that's why you get impingement syndromes occasionally. And normally the treatment for that could be anything from rest, NSAIDs, injections, and worst case scenario, sometimes we have to remove it. There are cases where this particular acromion bone hooks onto the particular supraspinatus muscle, and that can actually cause injury to the muscle or the tendon. So some athletes will get tears in this particular tendon simply because the morphology of the acromion process. So this supraspinatus tendon and partly the muscle is actually sensitive to injury simply because of that. Repetitive movements, overuse, all can cause injuries to this particular structure. The other structure that often gets dragged with this is actually the long head of biceps. You can see this, the long head of biceps actually travels right into the shoulder joint and actually attaches, as you can see here, attaches to the glenoid. So when there's an injury to the supraspinatus, there are chances where the long head of biceps equally involved, and you get a tendinous, this long head of bicep tendinopathy, which also can pose a lot of problem and it cause a lot of shoulder pain as well, and impingement like symptoms. So it's good to know that one of these two things can always occur to someone who has shoulder pain, and is one of the most commonest reasons for why one gets shoulder pain. If you have any of what I've just described, you would want to get it checked by a sports physician and see if we can sort it out for you, and possibly modulate what you're doing, or see if any of the techniques of training or whatsoever that's actually causing or aggravating the problem. And most of the time you do not have to stop training altogether unless there's a tear through and through for the supraspinatus, and whereby that you might need some surgical intervention. Otherwise, for partial injuries, normally activity modification along with some treatment modalities can actually help recover this. So I hope you guys have learned something. If there's questions for me, please do ask. I guess my 5 minutes is up. See you again in the next session.